I'd like to really just echo Tracy's comments, particularly to let everybody know that we're very pleased that everybody's here today for this One Medicine in Action Awareness and Collaboration and Change seminar. We're really excited that we've got a wonderful schedule of speakers for this afternoon, and it really will be a really exciting event. And I think it's really important that we all participate in the interactive parts of the afternoon as well. So with no further ado, I will get started with my introduction to the work of the Humanimal Trust, and hopefully enlighten you into some of the work that we've been doing over the last few years. So as Tracy said, I'm Roberto La Ragione. I'm chair of the trustees of the Humanimal Trust. So firstly, One Health and One Medicine. What is it? Well, two concepts that are interrelated but are synergistic rather than synonymous with each other. And most recently, there's been a redefinition of One Health by all of the organisations involved, including the OIE, WHO, etc. And it's defined by the One Health High Level Expert Panel as an integrated, unifying approach that aims to sustainably balance and optimise the health of people, animals and ecosystems, whilst at the same time recognises the environment, including ecosystems, are closely linked and interdependent. With this approach, it's able to mobilise multiple sectors, disciplines and communities at varying levels of society to work together to foster well-being and tackle threats to health and ecosystems, while addressing a collective need for clean water, energy, air, safe and nutritious food, and taking action on climate change and contributing to sustainable development. The foundations of One Health lie very much older concept of One Medicine, though, and that's what the Trust is all about. One Medicine does not seek to determine the more well-known One Health concept, but merely goes beyond it in its scope. And so One Medicine emphasises that close interdependence and similarities between human and veterinary medicine, including all of the areas around general medicine of humans, domestic and free living animals. And it's really about bringing all of those ologies together, as Calvin Swartz said in 1964. It's combining all of those together and looking at those synergies that are there between the different types of medicine. Our own definition of One Medicine, though, is about drives in collaboration between vets, doctors, researchers, and allied health and scientific disciplines, so that all humans, and indeed all animals, benefit from sustainable and equal medical progress, but not at the expense of an animal's life. And really, it harks back very much to the original quotes by Rudolf Virchow many years ago, where he noted that between animal and human medicine, there is no dividing line, nor should there be. And absolutely, the Trust agrees with the statement. So what brings human and veterinary medicine together? Well, many different things, but right at the beginning, same clinical language in many ways. There's high-level anticipation of patient care, common values of love, empathy, compassion, the history of medical epidemiology, embryology, anatomy and physiology. They're all very similar across the species. We think about comparative oncology. We see very similar tumours in animals and humans, and at the microscopic level, they're almost identical or even identical. It's only when we look at the genetic makeup that we may see some differences. Think about comparative biology, comparative microbiology when we're thinking about zoonotic diseases, for instance, and those diseases that can spread from certainly from animals to humans, and where we see reverse zoonosis, where we're seeing human to animal transmission. And of course, we've seen that in the most recent pandemic. And of course, public health and epidemiology and the technological advances. When a new medicine or a new device or technology is brought to commercialization, actually it could be used both in animals and humans. It's just the regulatory parts of that make that very complex. But in many cases, we see repurposing of drugs in particular between humans and animals when they're being used. And of course, we know that traditionally many of those drugs will have been and techniques developed using animal models. So what are the benefits of a one medicine approach? Well, advances in human and animal medicine can be achieved more quickly with closer collaboration and mutual learning. And we believe this will lead to fewer laboratory animal tests until one day they become obsolete or very rare. We also share responsibility for creating a fairer society with better opportunities to benefit equitable from medical progress for humans and animals. So here we see some of the benefits, just a collection of 4 papers here where we see one medicine really in action, where we're looking at oncology and arthritis and many other conditions where there are similarities between the species, the disease, and how we manage and treat those diseases. So back to the trust. The origins of the trust are right back on the 6th of May 2004. So today's our anniversary when Professor Noel Fitzpatrick founded the trust. As a vet himself, he experienced the deep divide between human and animal medicine and saw how unfair this can be. And very frustrated by the lack of opportunities to share what he was learning from day-to-day practice with animals or the benefit from relevant learning from human medicine, he decided to create the platform himself, Humanimal Trust. And one of the main areas of Humanimal Trust is to emphasize the 3 R's, where we look at reduction, replacement, and refinement. But actually, the trust has a 4th R, reciprocity, where we see collaboration, two-way street in medical advances to benefit animals too. So humans and animals benefiting from the same medical advances. So the trust has funded a number of areas of research, and we have 5 main pillars within our trust, and these include infection control and antimicrobial resistance, cancer, brain and spine disease, bone, muscle and joint disease, and regenerative medicine. And we've been funding projects in all of those areas over the last few years. And I'd like to give a few examples of those. So one project, which is currently undergoing at University of Cambridge with Professor Matthew Allen, is understanding how osteosarcoma spreads. We know its tumours occur in both humans and dogs, and indeed potentially other animals. An incident rate in dogs is approximately 10 times higher. But why? So investigating better ways to predict which patients have a higher risk of their cancer spreading is really important. And this project is looking at that. Can we find markers of how we can predict the likelihood of a patient getting cancer and it spreading? We also have a number of funded projects with Action Medical Research for Children, where we're funding in collaboration with Action Medical Research, and 2 specific projects here. One, preventing infection and reducing risk of antibiotic resistance in critically ill children, and a second, looking at juvenile idiopathic arthritis and personalising drug treatment for those patients. We've also looked with the University of Glasgow and funded a project there on the development of liquid biopsies for Canine patients. And this is really a great example of reciprocity in action, where we're looking at these biopsies to detect fragments of DNA from tumour cells so we can characterise those and diagnose them rapidly so those patients can benefit from the best possible treatments as quickly as possible. Previously funded projects include PhD studentships, and indeed one that's finished recently, and I'm just starting to publish some of the PhD. And this was looking at the use of alternatives to antibiotics and indeed bacteriophages, viruses that infect bacteria. And Dr. Lucy Griss was the first recipient of a Humanimal Trust PhD studentship and investigated how these specific bacteriophages could be used to treat very pathogenic E. coli, which were causing infections in canine patients. and this was at the University of Surrey. So the world we want to see in the future is human and animal health have demonstrable improved as a result of one medicine. One medicine is widely understood and embraced. Collaboration between human and animal medicine is the norm. It happens, but it should be the norm. There is sufficient funding and robust public policy to support collaboration between human and animal medicine, so that actually a real difference can be made to medical progress for both animals and humans. And there is no scientific need and no legal requirement for laboratory animal testing. So I'd like to finish off with a couple of slides. The first one, looking at our charitable activities, our new mantra of I care, where we think about influence, collaboration, awareness, research, and education. I care, and this really stands for what the trust is. And please do take a moment to read through those again, but it's a nice way to remember what our trust it really represents. And finally, I'd like to encourage you all to think about joining the One Medicine community. We have a wonderful Humanimal Trust hub, which is a fantastic platform to interact with like-minded individuals, share ideas, work with medics, vets, nurses, allied professionals, and be able to really interact in a One Medicine community. So please do click on the link. We'll send that through later as well, and have a look at what's on the hub. We really encourage you to join. And also we encourage members and participants today to become a specialist volunteer. There's many opportunities to support One Medicine via the hub, writing articles, giving talks, and many other activities. So if you're interested in the hub or becoming a specialist volunteer, please do contact the team, and we'll be very happy to help. So with that, I'd just like to add my thanks to everybody for joining today, to what is going to be a really exciting afternoon. And with that, thank you all for supporting the Trust. Thank you.